is Anna Flynn. Anna's the Director of Policy Development at IHPA. Anna's one of the originals at IHPA. She started as Communications Manager and was instrumental in setting up both conferences like these, our website and our social media presence before moving across into the policy role. Anna, previous to that, worked in the New South Wales Government in Family and Community Services. She's got a Master of Arts in Communication Management and a Bachelor of Arts in English and Politics, which has really helped her develop a niche for translating the very complicated technical work that IHPA does into quite plain English and hopefully understandable. So Anna now leads the policy team at IHPA and is leading the work to undertake the Global Horizon Scan, which she spoke about yesterday, and the work that Shane's just referred to, and looking at how value-based healthcare can be adapted in the Australian public hospital system. So thanks, Anna.
Thank you, James. And good morning, everybody, and welcome to the conference. Just arrange my notes here. So I'm here this morning to provide a quick overview of our new mobile app that we call WRITEitRIGHT, and we're officially launching it today. So I'll give you a little bit of information about the app. So it's a simple reference tool that we've built to help clinicians improve clinical documentation. It provides clinicians with exact diagnostic terms to accurately record a patient's condition. It prompts the user to move from general to specific terminology using clinical terms and diagnoses drawn from ICD-10 and the Australian coding standards. So this supports a clean handover from clinical staff to coders, reducing the number of queries and amendments after a patient has been discharged, and ultimately enables a more complete medical record that accurately tracks the patient journey, improving the safety and quality of care delivered. So why has IHPA developed an app? I'm sure you're asking. So I'll give you a bit of background. Initially, a coding audit by the Australian Commission on Safety and Quality in Healthcare highlighted the need for better clinical documentation. And subsequently, the 2016 Heads of Agreement, signed by all Australian governments, committed to a series of reforms in public hospitals, and this included a focus on safety and quality. So this initially led to work at IHPA to develop funding mechanisms aimed at improving safety and quality. However, as Shane also alluded to, IHPA's always been conscious that funding alone is not the driver of change, and we developed this app to support the safety and quality reforms. So how does it support safety and quality? So accurate clinical documentation enables the identification and monitoring of complications, which informs strategies to improve patient safety and quality of care, which allows for the development of measures to improve patient outcomes. So in its simplicity, WRITEitRIGHT is a standalone reference tool. It's not dependent on integration with hospital management systems or electronic health records, and it doesn't collect or store any patient data. So I know there's, I think that we have a number of representatives here from local health networks this year. I think we've got up to 80 different LHNs represented. Welcome to all of you. And if any of you think this is an app that could be useful within your hospitals, we've developed a number of bits of collateral that we're happy to share with you. We have some IHPA representatives at the back. Ivana said she was going to give a wave if I pointed her out. There she is. If you want to go and have a chat to Ivana, she can help you with collateral to get the word out. Obviously, you can download it right now, although if you all do it, it might crash, so maybe we'll go row by row. And also, this is the first version of the app, so we're very keen for your feedback. It's a work in progress, and we're keen to hear your ideas as to how we can improve it, and maybe once it's been used on the ground, some feedback from people on the front line. But we've also got a log sheet as well that Ivana has, that if you have any comments now or during the course of the conference, please just go and have a chat with them, and they'll be able to take your feedback there and then. Okay, and I'm going to finish. We have a 90-second animation that we've put together that gives you a bit more detail about the app and actually sums up what I've just told you now far better in 90 seconds. Thank you.
WRITEitRIGHT, an app from the Independent Hospital Pricing Authority. Designed as a reference tool when documenting healthcare records, WRITEitRIGHT helps to bridge the gap between clinicians and clinical coders in the reporting of specific diagnoses. So how does WRITEitRIGHT work? When a clinician treats a patient with pneumonia, they may not be aware that one additional word can make a big difference in the specificity of the diagnosis for reporting purposes. By searching pneumonia in the directory, the app indicates that bacterial pneumonia may provide a more specific diagnosis and in turn provide a more complete healthcare record. You can search alphabetically by diagnosis, refine your search by specialty, and bookmark frequently used terms to save time. The terminology draws on ICD-10 and the Australian coding standards. By ensuring clinical records are as accurate as possible, hospitals can better monitor the safety and quality of care provided, improving patient outcomes. Accurate records also assist hospitals with service planning and future funding requirements. By recording the right diagnosis the first time, you won't have to update records later, saving both you and the clinical coders time. With the WRITEitRIGHT app, everyone is on the same page. Download it free from the App or Play Store today. WRITEitRIGHT, an app from the Independent Hospital Pricing Authority.